In the culture war, gender affirming care to minors was a major issue for the Republicans. In fact, it was one of the things that Trump campaigned on ending and stopping in terms of his campaign. Even though it was a smaller promise, it was a promise, and now he's actually acting on it. The HHS unleashes sweeping crackdown on child sex rejecting procedures, threatens hospitals' Medicaid funding. New regulatory actions would bar hospitals from Medicare and Medicaid programs providing transition procedures to minors. This practically ends gender affirming care for a lot of the major providers within the U.S. Because this Medicare and Medicaid are the biggest insurance providers in the nation, as they are nationally funded. So if Trump cuts off providers that actually do the gender affirming care, particularly for minors, then it will have a effect on the hospitals, which will then result them in not actually doing anything because they want to keep that medical funding for the other procedures that they do and other items. So this is a major win on the Republican side for this. So the exact procedure that they're doing is cutting Medicare and Medicaid, but they're also doing some other stuff to cut it. So let's read it through it. So here's a quote from Robert F. Kennedy Jr. Today we are taking 6 defensive actions guided by gold standard science and the week 1 executive order from Donald Trump to protect children from chemical and surgical mutilation. Secretary Robert F. Kennedy said during a press conference Thursday afternoon, announcing that he proposed the actions. So there's 6 actions that he's going to do. Cutting Medicare and Medicaid is one of them. So the Center for Medicare and Medicaid Services rolled out policy proposals that would bar hospitals from carrying out performing puberty blockers, cross-sex hormones, and certain surgeries on patients under the 18 as a condition for participation in Medicare and Medicaid programs. The majority of U.S. hospitals participate in Medicare and Medicaid, according to HHS. So basically, they were cutting out pretty much every single surgery and health thing for gender affirming care, because puberty blockers is considered the first step in the process, and then it's going to be cross-sex hormones and then surgeries. So they're basically ending all gender affirming care for under minors. Now, this is incredibly good, particularly for children, as they actually are massively negatively affected by this. So if you look at it here, this is a study by the risk of suicide and self-harm following gender affirming surgery. So it's a study by the National Library of Medicine and the NHI. And if you look at it, the results were individuals that underwent gender affirming surgery had a 12-fold higher suicide attempt risk than those who did not. So this proves that this kind of stuff is horrible for people. It's causing a lot of mental long-term harms to them. Additionally, it's going to even be worse for children too, as first of all, a lot of children, including myself, don't really know what's going on when we're in puberty. It's crazy time and whatever. So if they don't act, and then afterwards it's more clear. But if they end up getting surgery during this period in their life, then it will be even worse, as there will be even more craziness within their mind. It will be even more stressful, more crazy, and it would be even more unhealthy in the long term, as it will be more issues for them as they have to struggle with the fact that they now went through the surgery and the long-term implications that it has. So this is horrible for mental health. With gender affirming care is horrible for mental health in terms of this. So this is a major win for children. Additionally, it also has a lot of other long-term side effects that the gender affirming care also has a lot of long-term side effects too. For example, this is another study by, again, National Library for Medicine. Research demonstrates that compared to cisgender populations, transgender and gender diverse people suffer from more chronic health conditions, experience higher rates of health problems related to substance and mental illness, have higher prevalence of early onset chronic diseases. And it also has, I believe, part of here, This chapter's it also has other long-term health implications. Like, let's see, I know it mentioned it here. If you go to here, chapter 5, said if you look here, including bone cancer and cancer, bone health, osteoporosis, and fertility, and many. It also has many other issues too. So it's not just those issues. So in fact, right here, there it is. So including impact of including cancer, bone health / osteoporosis, fertility, and sexual function. So basically, if they go under these surgeries, they're going to have long-term medical issues too. And that's going to harm them and their ability to function in the future, both biologically and mentally, as shown earlier. In fact, that also results in other issues from the fact that they have those long-term medical costs from gender-affirming care and those long-term issues. It actually results in a larger tax burden too. Because if you look at here, this is a article by the HRC Foundation, and it said total costs of transgender specific care from one person to another are often estimated between $25,000 and $75,000. That is a lot of money, but that's minimal compared to other expensive procedures such as defibrillator implants, $68,000 to $102,000, and colon cancer drugs, $250,000. So these types of gender affirming care have long-term expenses on the patient themselves. This will actually, and it's also going to be incredibly harmful for children more, as it's also being affecting them more in their developmental phase. So it's going to affect them even worse in the future. It's going to have even more of the problems than in comparison to someone that's an adult and transitioned as an adult. So it's even worse for them. Additionally, when they're a child, they don't know what they're doing. In fact, I probably don't know what I'm doing half the time, but as I'm still a child, but technically, even though I'm 17, but still, the fact that they have all this, in fact, that they're so young, and particularly when puberty starts, sometimes they do the transitions before that, right before that, even in the middle of it. They're still a lot younger than even 17, so they even don't know what they're doing. But now, because they have gone through all these surgeries and these medical procedures, they'll have a long-term cost associated with them. And it's going to negatively impact their financial futures too. Not just a drag on taxpayer dollars, but it's also a drag on the kids' finances. And they don't even realize these issues when they are trying to get gender-affirming surgery when they start out. They don't realize these medical expenses. So it's not good for children, both financially, health-wise, and mentally for this. So this is a major win for the banning of this. In fact, it's not. In fact, another example of it, of another country banning it, is actually Sweden. Sweden puts brakes on treatments for trans minors. Now, Sweden is seen as one of the most socially progressive nations in the world. They are incredibly have a high tax burden, have a whole bunch of. They've supported immigration for a long time. They have supported this for one of the first nations to actually support it, but now they're actually walking it back because they see the issues and the medical harm that this type of transition causes to people that are children. They have and children that have no idea what's going on with their own bodies at the time. So it's not good for even progressive nations like Sweden put brakes on this, and so that just shows you that it's even progressive nations that are supposedly supportive of this type of stuff are starting to realize that they're going back. So Republicans are winning on these issues, and this is even shown in what's going on with these regulations that are going on in the Human Health Services Department within the federal government. Another thing that they're also doing, besides just the medical banning of Medicare and Medicaid, is also that it's saying for Centers for Medicare and Medicaid services related to another proposed rule that would block federal Medicaid funding for procedures aimed at altering sex of a child under the age of 18, and which HHS also will apply to federal funding of Children's Health Insurance Program, CHIP. So it's not just Medicaid. It's also other programs like that they're also banning. Banning these gender-affirming cares for, which is going to help for the long term, and it's going to disincentivize parents, first of all, advocating for their children to get this because they'll realize it's so expensive. Second of all, it's going to actually help children in the long run that are struggling with these issues, struggling with the gender-affirming care. As if you keep affirming them, it's going to harm them in the long run. Just like if you keep affirming a kid that's doing something bad, like breaking something, they'll just continue to break it. If you do something in this situation where it's gender-affirming care here, you're going to affirm a delusion that they have that will harm them in the long run. It's not healthy that they do this. That we have kids that are on gender-affirming care, do these surgeries, do these drugs that have long-term fertility problems, bone density, cancer problems. Not good for them financially in the long run either, as you just saw in that it cost for certain medical treatments associated with it hundreds of thousands of dollars, $25,000 to $100,000 in terms of medical costs. So it's not good for children financially in the long run. It's not good for them mentally in the long run, as you saw this 12x suicide rate and suicide attempts compared to the normal person. And you also see a massive health issues in the long run too. So it's not healthy for them. So this is a major win in terms of protecting children and their health for the long run. And go Trump, go Kennedy on this. This is really good. And honestly, I think they should have done it from the start. As Trump did do an executive order from the start, but I think leveraging Medicare and Medicaid like they did with this, they should have done it earlier, a lot earlier. And hopefully they continue to do stuff like this to limit this as much as possible, as it's not healthy for anyone at all. So a major win for Trump here in these new regulations, and hopefully it continues like this. Anyway, I'll see you all next time, and have a happy day.